Okay, let's dive right into this. A major pharmaceutical brand, a name a lot of people know, has just changed hands here in India. And we're talking about a deal that says a whole lot about the strategy and future of the country's healthcare market.
It's a classic question, right? But in the world of medicine, a name is so much more than just a label. It's all about trust, reliability, and just familiarity. Think about it. For doctors prescribing it and for the patients who rely on it every single day, that brand name is basically a promise of quality and consistency. And that's exactly why it's such big news when one of the most established names in the game gets a new owner.
So let's get into it and unpack exactly what happened in this major pharma deal.
Okay, so here are the basics. You've got the buyer, Mankind Pharma, which is a huge Indian company. They're buying from the seller, Roche, a global giant. And what are they buying? The Rivotril brand, specifically the rights for India. This means Mankind is now in charge of the whole shebang, making it, marketing it, and getting it out to people all across the country.
So let's take a quick look at the two key players at the heart of this story.
On one side, you have Mankind Pharma, a real powerhouse within the Indian market. And on the other, Roche, one of the biggest pharmaceutical companies on the planet. So what you're seeing is this really fascinating dynamic, a leading domestic company buying a key local asset from a global leader.
Now, to really get why this deal is so important, we need to look at the prize itself. What is it that makes the Rivotril brand so incredibly valuable?
Rivotril is the brand name for the drug clonazepam. It is a very widely prescribed medication, and its main job is treating epilepsy. This makes it an absolutely critical medicine for so many patients who depend on it for their daily health.
And this gets us to the power of what's called a legacy brand. I mean, trying to build a new medication brand from scratch is a long, expensive, and difficult journey. It can take decades and a massive investment to build that trust with doctors and patients. Buying an established name like Rivotril, well, that's a strategic shortcut. You instantly get all that history, all that trust, and all that market presence on day one.
Which brings us right to the heart of Mankind Pharma's strategy. This wasn't just some random purchase, oh no, this was a very calculated move.
Mankind's goal here is crystal clear. They want to become a much bigger player in the central nervous system, or CNS, market. That's the area of medicine that deals with conditions of the brain and nervous system, things like epilepsy. So acquiring a top epilepsy drug, it fits perfectly into that plan. And hey, you don't have to take my word for it. Here's a direct quote from Atish Majumdar, a senior president at Mankind Pharma. He says this deal will, quote, significantly boost their presence and let them get this trusted brand to even more patients. It's all about strengthening their position and expanding their reach.
You can really break their whole game plan down into 3 simple steps. First, they identified the CNS market as a key area where they wanted to grow. Second, they went out and acquired a top-tier, trusted brand in that market, Rivotril. And third, they're using that acquisition to solidify their leadership and serve more patients. It's just a really clear and powerful strategy.
So we've covered the who, the what, and the why. Now let's just pull back for a second and look at the bigger picture, the ripple effect of this whole deal.
This transaction has some pretty clear implications for everyone involved. For Mankind Pharma, it cements their leadership in that CNS space. For Roche, this is part of a much bigger global trend. What you're seeing is multinational giants selling off these older, well-established brands in certain regions, so they can focus their money on R&D for the next generation of blockbuster drugs. And for patients in India, well, it ensures that a critical, trusted medication stays accessible, now under the care of a major Indian company. So the crucial point here is this. This deal is way more than just a brand changing hands. It's a strategic realignment. It signals the growing ambition and muscle of Indian pharmaceutical companies. They aren't just manufacturers anymore. They're becoming the new custodians of major brands in their own home market. And that's a move that reshapes the entire healthcare landscape.
It's really a sign of a dynamic, evolving market. Which leaves us with one final thought. In an industry this competitive, with both domestic and global players making these big strategic moves, who's going to make the next big play?